My name is Cassandra Snyder-Wyatt. I am a 7th semester nursing student here at Lincoln University. I will be performing trach care and trach suctioning on Miss Opal here today. It is the 18th of September 2019, and I've already come in and I've talked to Miss Opal. I've introduced myself. I've identified her by 2 patient identifiers, her name and date of birth. I've gone ahead and assessed my patient. I could tell by her wheezes and her crackles in her lungs, her respiratory rate and pulse are increased, and her ease of breathing and the rhythm of her respirations were not that great. So using that criteria, I've determined that she needs to be suctioned. So I'm going to go ahead and provide us with some privacy. However, for video purposes, I'm going to go ahead and open that curtain back up because my suction and everything's over here. So I raised Miss Opal's bed, and I'm going to go ahead and perform hand hygiene. I'm going to turn my suction on between 80 and 120 and hyperoxygenate my patient for the time being because I'm going to suck all that air back out of her lungs here in a minute. So, if she had super thick secretions or they were very difficult to get out, then I would go ahead and turn that suction up a little bit higher, but for now we're just going to leave it at 80. I'm going to go ahead and put a towel over her just in case I get her dirty while I'm suctioning. And then now we're ready to start. So I'm going to open up my suction catheter kit carefully. I'm going to pour in my saline here. I'm going to throw it away. My trash can is down here. I'm going to go ahead and put my sterile gloves on. Gotta be careful here because I do have a suction kit open. Stay. Okay, I'm going to don my non-dominant hand first. My dominant hand. Go ahead and throw this away. That's out of my way. Okay, and now I'm going to take my suction kit here. Okay, so with my non-dominant hand, I'm going to grab my suction tubing. I'm going to connect it. Okay, Miss Opal, are you ready? Pull this down. I'm going to go ahead and lube my suction catheter, test my suction. I hear it working. Okay, Miss Opal, if you get uncomfortable or you can't breathe or you need a break, raise your left hand and I will stop, okay? So I'm going to make sure that as I'm going into her airway, I do not suction. I'm going to meet resistance. And at that point, I'm going to intermittently suction my patient. Clear out my tube. If I needed to hyperoxygenate her again, if she needed a little bit of a break, if she started desetting, I would go ahead and put the oxygen back on, but she was okay. We're going to go one more time. Same thing. Don't suction on the way in. Intermittently on your way out. Great job. I'm going to give her some more oxygen again. At this point, I would disconnect my suction, turn it off. I'm going to grab the V-sponge under her trach and pull it out. I'm going to move my towel, and I'm going to put it over here for now. For For the video's sake, I'm going to keep my gloves on just for time's sake, but in real life I would go ahead and tear both my gloves off with my suction tubing and my V-sponge in my glove and throw them away. I'm going to clean up my area. At this time, I would also go ahead and make sure that my patient's lungs sound better, that she definitely does not need to be suctioned again. Miss Opal is fine. Her lungs sound a little bit better. Her respiratory rate is a little bit better, and her heart rate's down. So I'm going to go ahead and get ready to start opening up my trach care kit. I'm going to perform hand hygiene again. I'm going to open my kit. Set up my sterile field. There would also be gloves in this kit, so I'd go ahead and don those. So now I'm sterile. And then I take all my stuff out here and get everything ready.
University's on lockdown, so we're going to lock this door behind you. Okay. Do not leave the building until we give you an all clear.
Okay. So I'm gonna go ahead and continue to set up my sterile field here. There is a 2-inch border that I'm being very cautious of. I'm going to put half my normal saline into one container and then the other half in the other container. I'm going to open my hydrogen peroxide and dump it in my first container. Okay, and then now we are ready to start. Okay, Miss Opal, I'm going to go ahead and take your oxygen off here. I'm using my non-dominant hand to grab her cannula. I'm going to put it in the hydrogen peroxide mix and let it kind of soak for a minute. And then I want to make sure that my brush here is soaked with normal saline. I'm going to take my non-dominant hand and grab my cannula back out of my hydrogen peroxide. I'm going to clean it with my brush with my dominant hand. And then I'm going to let it soak in normal saline to kind of rinse off. I'm going to grab it with my dominant hand. Tap the cannula on the inside of the container here. Then I'm going to put it back, making sure that I hold the flange while I'm putting it in. I'm going to push until I hear the click. Great job. And then at this time, I'm going to go ahead and clean around my patient's incision. So I'm going to take one of my sponges here, dip it in the normal saline, make sure it's not super wet, and I'm just going to clean around her trach. I'm going to clean around the flanges, under the ties, under the flanges as much as I can while staying sterile. Okay. I'm going to go ahead and take another gauze here and dry my patient. You're trying to protect the skin integrity here. Make sure that you stay as sterile as possible while doing this. Great job, Miss Opal. Okay, at this time I'm going to go ahead and change my trach ties. So I'm going to grab that. If I had an assistant, I would have them hold the flanges of the trach, but at this time I do not. So we're just going to work with what we got. Okay, Miss Opal, go ahead and lift your head forward if you can for me. Perfect. And I left the old tie on there, the old trach tie on there. That way the trach stays in place while I do this. I want to make sure that I have at least 2 fingers that fit underneath this trach collar here. Trach collar. Secure it. Then I'm going to take off the old trach collar. Okay. I'm going to throw it away, undon these gloves, and then I'm going to go ahead and don a new pair of gloves to put the new Via sponge in. So if before I don my new gloves, I could clean up my area. At this point, I have gloves on, so I'm sterile again. I'm going to take my Via sponge, and I like these Q-tips. And we're going to do our best to do this as sterile as possible. So I kind of try to wrap that dressing around my Q-tip, that way it stays sterile. I'm going to make this hand unsterile, that way I can push this up here. Great job, Ms. Opal. And then you just kind of want to make sure that you're getting this as it should be. Okay. All right, so then I would put my oxygen back on my patient. I'm going to turn it back down to what it was before. I'm going to take off my gloves, perform hand hygiene, clean up my area. And then I would go ahead and go document that I changed the patient's dressing, that what kind of secretions and the color of the secretions and the amount of secretions that came out, and how well the patient tolerated the procedure. I would want to make sure that I lower my bed back down for patient safety, make sure the call light is within reach, and oops, where's that go? Then proceed to document. Can you get this out?